Good Tuesday afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness here at Knox County Health Department. Our moment of gratitude today is dedicated to our temporary team members who have readily jumped into our COVID-19 response. We are grateful for the funding that enabled us to bring these folks on board. And some of these folks didn't have a history of working in public health, especially in a pandemic, and have undergone extensive training in order to learn the ins and outs of our response. These individuals provided some relief to our staff who have worked around the clock and are attempting to get back to some of their typical job duties while still working the response when necessary. That said, we're also grateful to all the folks in our community who are treating our employees with kindness and respect when you receive a call from us. These folks are doing their jobs the best as they can in the situation, unlike any that we've ever been in before. And we are grateful for those in our community who have received a call from us either as a case or a close contact and have willingly agreed to follow guidance in order to keep those around them safe and healthy. So thank you to all of you. Our real world example of putting the 5 core actions into play is going to the grocery store. This is something that you've likely continued to do since the pandemic began. So you likely are feeling pretty equipped to shop for groceries in a safe manner. But sometimes the places where we feel the most comfortable are the ones where we let our guard down. Remember to always wear your mask when grocery shopping. If you run into someone you know at the store, keep your mask on and make sure you stay 6 feet away from them. If you are at higher risk for illness, check to see if your local store has special hours for people that are higher at risk. And if they do, try to do your shopping at those hours instead. Or you can always use curbside pickup as an option if your store offers that as well. If you can, try to limit the times that you go to the store. And also, if you're able, limit the amount of people that go with you. Instead of making it a family affair, designate one person to do the grocery shopping to limit the potential risk for others when you can. Most grocery stores will disinfect the shopping carts or baskets before you use them, but just in case, you can bring along extra sanitizing wipes and do it yourself as well. Before entering and after leaving the grocery store, use your hand sanitizer with at least 60% alcohol. When you get back home, wash your hands before preparing to eat any food, or preparing or eating any food. Sorry about that. These are just a few simple things you can do to keep yourself safe while also going about your normal life. We're testing this week at the Hall Senior Center on Crippen Road, Wednesday through Friday from 9 a.m. to 1 p.m. Next week, we'll return to the Jacob Building to test Tuesday through Thursday from 9 a.m. to 1 p.m. As a reminder, we are no longer collecting insurance. We have heard anecdotally some misinformation regarding our testing that we would like to address. Regardless of where you were tested, if you are positive and a Knox County resident, we will contact you. Per state and federal guidelines, we are required to attempt to contact people who were positive for all reported diseases or reportable diseases. If you do come get tested at Knox County Health Department through us, you will wait in line until it's your turn to complete a registration. This is where we'll collect information like your name and your address and your phone number. We will also give you information about how to access your results via a portal. You will then be tested by a member of our team. We will not give you a letter with your result during this time, as the test still needs to go to the lab in order to be processed. You will instead be given information, again, that we mentioned, that has instructions on how to access the portal and how to quarantine until your results come back. If you receive a positive result, someone from KCHD will call you to begin our case investigation. That's when we ask you questions like where you've been and who you've been around, ultimately trying to determine if there's a known point of exposure and if other people could have been exposed to you as a close contact while you were infectious. During all of those steps, your information is kept private and we will never ask for your social security number or any bank account information. If you have questions about the process or unsure if you're getting a call from a legitimate contact tracer from us, please take the person's name that's calling you and a phone number and call our public information line at 865-215-5555, Monday through Friday. As a reminder, the Board of Health meets tomorrow via Zoom at 5 p.m. You can watch live on the Knox County's YouTube channel, website, or community television. Now we'll move into the local situation. We have 50 new confirmed cases since yesterday's report, giving us 6,029 confirmed cases of COVID-19 in Knox County since March. Additionally, we have 217 probable cases. 4,031 of our cases have recovered, giving us 2,160 active cases. 251 individuals have been hospitalized at some point in their illness, and 31 Knox County residents are currently hospitalized. And we're sad to report 2 additional deaths related to COVID-19, bringing our total to 55. As always, our thoughts and prayers go out to those who've lost loved ones. Before I open it up for questions, I want to quickly do another demonstration on how to properly wear face covering. We know this may sound repetitive and be basic sounding, but it's extremely important that folks know that how to wear these properly and that they are wearing them properly. The mask, I'm about to put it on, needs to cover your nose and your mouth and fit snugly around your chin. We have seen folks that have their mask pulled down, either so their nose or their mouth is open and covered or uncovered. That's not protecting anyone when you do that. You want to make sure that there's a barrier when you're sneezing, coughing, or talking. And so that's why it's very important to have the mask on your face. We also know some folks pull down their mask to talk. While we know this can be frustrating, and I'm going to take it off right now, to talk in mask and feel like you're being heard, we want you to keep your mouth covered at those times. Instead of pulling it down, you can speak louder and clearer to ensure people around you can understand what you're saying. The exception to this is if you are speaking with someone who is deaf or hard of hearing, or hearing impaired, and relies on lip reading to better understand you. In those cases, make sure that you step at least 6 feet away from that person before you remove your mask and start talking. We are all dealing with this and having to make adjustments, so it's important to remember you're not alone in this. Wearing face coverings is a research-backed way to reduce the risk of transmission, but it takes all of us to make a difference. And while we are encouraged with the lower number of cases that we're seeing, we cannot let our foot off the gas. Please continue to practice all of the 5 core actions in every situation. And I'll now open it up for questions.
All right, the first several questions submitted into the chat feature are from WBIR. Annie asks, why is testing moving to the Hall Senior Center?
My understanding, and I was out a little bit last week, but I believe there was a conflict at the Jacob building for that week that they weren't, so we weren't able to test there, and then we'll be back for the foreseeable future at Jacob building beginning next week.
Also from Annie with WBIR, are there populations of people who KCHD still has difficulty reaching for tests or education purposes?
We look at that all the time, and we've tried to make sure that our testing is accessible for folks and get our education out in many different ways and different languages, and are open. If you're hearing or if you know of populations that aren't being reached, please reach out to us. You can call our hotline and let us know, and we can look into that as well. But I think we're trying our best to the populations that we were seeing issues with, addressing those as we've been moving forward.
Also from WBIR, what's the fatigue level with KCHD at this point?
We're tired. It's a hard road. It's long hours. It's 7 days a week. Most people are very cordial and nice when we talk to them, but not everyone is. And so that can be challenging. And so we ask that everybody just have some grace and patience as we work through this situation with our team members. They're not making up the rules that are being enforced. We're following CDC and TDH guidance, all of the things that go along with that. Just be understanding that the things that they're asking you to do is to protect your friends, your family, your community as we move forward. But we're tired.
Also from Annie with WBIR, we've heard from some people that there are no follow-up calls from contact tracers after the initial positive test communication. Am I mistaken in thinking there was designed to be daily contact with people who test positive until they're out of isolation?
There should be daily contact. That gets turned over to the Department of Health and the central office team that's doing that. And we receive reports back that's saying where the attempts are being made. We will continue to look into that. So if you think you're supposed to be getting a call and you're not, call us. And we'll follow up and make sure that you're answering your phone. Those may come from a 615 area code. So know that as well. But we do follow up if we hear about those situations.
From WBIR, is KCHD seeing a great proportion of our county cases developing from UT or the campus area?
We have definitely seen cases, but we don't ever speak about any specific clusters or cases. But there, as you've seen reported in the news, there have been cases associated with campus, as was expected. And we will continue to work with the University of Tennessee to trace those individuals and make sure that proper isolation and quarantine guidance is followed.
Also from WBIR, are there concerns about parties going on near the UT campus?
We're concerned about parties happening wherever they occur, and really want folks to be following those 5 core actions all the time, wherever you are, at a party, at a sporting event, when you're hanging out with your friends, all of those things. We need you to be staying apart at least 6 feet, wearing a mask, washing your hands frequently, not participating if you're sick or you've been asked to stay home, and then frequently cleaning and disinfecting surfaces. All of those are important no matter what. So parties anywhere where people are not following those 5 core actions are a concern to us.
From Vincent with the Sentinel, on August 13th, more than 230 University of Tennessee faculty, staff, and students sent a collective letter to Dr. Buchanan asking the health department to strongly recommend that UT move to online instruction for some or all of the fall semester, or until the infection rate in the county is under sufficient control. Dr. Buchanan acknowledged receiving the letter, but has not responded. Does the health department plan to make any recommendations based on the letter, and will anyone respond to the letter?
So recommendations along those lines go up to, and would be the responsibility of the Board of Health to set forth those guidelines. And the letter was shared with the Board of Health. And that was the ask. So Dr. Buchanan's giving me the information because I did not receive that directly. And so we did that, and Board of Health will continue to look at the situation and what's happening in the area and make recommendations as they see appropriate.
From Annie with WBIR, we are seeing more children on playgrounds. Should playgrounds be reopened?
Again, are we talking playgrounds like at schools or public playgrounds, I'm guessing?
Yeah, Annie, if you want to
in general, I will say this. We want to recommend that everybody's practicing the 5 core actions wherever they are, and making sure that they're following the Tennessee Pledge that has guidance on playgrounds and where they should be open.
Also from Annie with WBIR, is there a local push for COVID-19 survivors to donate plasma now that the FDA has given emergency approval?
I know that our hospitals have been working in blood banks looking into all of that. We can talk about that more if we get more information for a push or a campaign of any sort. But we do recommend that people continue to give blood, and if they are have recovered from COVID-19 or interested in looking into that, contact Medic Blood Bank and get more information on how you can participate in that.
From Megan with WBLT, does the health department consider antibody infusions through blood plasma a viable treatment option for COVID-19?
On that, I would say defer to the providers who are treating the patients in the hospitals, who have a lot more direct experience in working with that. I can speak to what the FDA approved and go with that, but I think you should direct those questions to the hospital providers.
Also from Megan with WBLT, what happens if a teacher is exposed to COVID-19 through a student? Can you walk us through the process? Will that teacher be removed from the classroom?
If anybody's been within 6 feet for more than 6 minutes of any case, so that could be a teacher being exposed to a student, we do, as soon as we find out, we would reach out to that individual and ask them to quarantine. So that would be removing them from school at that point when we know about it and can follow up with it. Yes. Did you say 6 minutes or 10? Did I say 6? Oh, I'm sorry. Somebody said I said 6 minutes. Within 6 feet for 10 minutes or more. If I said that wrong, I apologize.
From Jeff with WATE, can you tell us about how case reports are shared between Knox County schools and KCHD? Are you reporting cases to the school system? Do they tell you when they learn of a positive test?
It's both directions, actually. So we have trained the school nurses and the leadership in that program as contact tracers. They've gone through all of our training. They've signed all of our confidentiality and HIPAA agreements and been through, actually volunteered with our Medical Reserve Corps. And so they let us know when they find out about cases, because sometimes they do find out before the official reporting system makes it through, or we let them know as well when there are cases. And they assist us with tracing within the schools. We still do the initial interview for every case and do the outside of school contact tracing as well.
From Brian Hornback, last night at County Commission meeting, Commissioner Bustler gave some information that he said he obtained from the state. Will you please explain again the quarantine time for positive test results and the isolation time for individuals that have been in close contact with someone that tests positive?
Okay, that's actually the phrasing of that would be backwards. So isolation is for people who test positive. So those are for cases, and folks in isolation or in isolation test positive for at least 10 days from either their onset of symptoms if they're symptomatic, or from when they test positive if they are asymptomatic. And it's 10 days, and then they also have to be fever-free and feeling better for at least 24 hours for that to get out of isolation. So if you're still feeling poorly and still have a fever at day 10, that could continue on longer. For people that are close contacts of cases, they are in quarantine for 14 days from their last known contact of the case. So the last time they were with or in close contact with the case. So the last time that they were with them from 14 days from then. And household contacts, that does mean it can be longer. So if you're living in the household and you cannot completely separate from the case, meaning not sharing any spaces, bathrooms, anything like that, then your quarantine period begins when the case's isolation period ends. So it could be as long as 24 days.
From Jeff with
Or
WATE.
more, actually. Sorry.
From Jeff with WATE, he asked, can you give us the ages and genders of the most recent deaths?
Yes, today's two were a 91-year-old woman and an 86-year-old man. And then we reported one on Saturday that is a 51-year-old man.
Annie with WIR was clarifying she meant public playgrounds, mostly
Okay.
parks.
So on public ones, we definitely ask that folks follow the Tennessee Pledge for playgrounds.
From Vincent with the Sentinel, a presentation to the Board of Health a couple weeks ago detailed symptoms experienced by deceased COVID-19 patients in the Knoxville THA district. These show some unusual symptoms like nausea or neurological issues. These conform to some emerging data about non-standard COVID-19 symptoms. Do you have any guidance for patients or healthcare providers who may be seeing unusual presentations of COVID-19?
I don't have any additional. We ask that you follow CDC guidance and look at what the symptom presentation is there. And there are, gastrointestinal illness and nausea and vomiting can be one of those less common, but are on the symptom list. And then for neurological symptoms, if there's a question, look into it. If you're concerned, people can absolutely the provider can test the individual if they think there's a concern. But then again, I'm going to remind everybody, this is an emerging illness. This is a new infection and we're learning more every day. And so we do need to keep an eye on those things. So if there becomes a consensus or more information that we need to share from CDC or TDH, we'll do it. But we also encourage providers to keep an eye out on what's emerging in the science and the data about this infection as well.
All right, any other questions? Please go ahead and submit them now. All right, not seeing any other questions come in. So thank you all for joining us, and we will be back with you on Thursday at 12:30. Have a good rest of your day.